Good morning, Mr. Nader. How are you, sir?
Good morning, Mr. Ross. Always a pleasure to be on the show again.
Well, Mr. Nader, another week and the crisis continues. Do you have any updates about the situation?
Well, we're in about day 70 of the crisis. We're like about 2.5 months into the crisis. And I recall being in Albany, and when the first case popped up in New York, we never thought that we would get to this stage. And, unfortunately, looking back, there should have been a lot of other measures put into place, to try to curtail the spread of this virus. And we know it's a global pandemic. We know that many countries throughout the world are impacted greatly. And of course, we knew that we in the USA, and especially here in New York, we would have to deal with it. And we've learned a lot from the process. And, each week we learn about new initiatives. We see the numbers increasing. We try to resolve areas of need and concern. And it seems as if every week there's a new item out there to talk about. First of all, we know that the numbers have reached the 1.4 million. This is nationally. And the USA has a death rate of about 85,000 people. And that's a large number. And we in New York are impacted even as far as our percentages, even to a greater amount, because within the USA, New York State, and especially within New York State, New York City, Westchester County, communities like Yonkers have really been hit hard. We're in what they call the epicenter, which is really the inner heat or inner core of the crisis. So the rest of the nation is really looking at communities like Yonkers and New York City and New York State in general, and when I look at New York State, and it has about 340,000 cases. I mean, each week when we get on the show and we talk, the numbers continue to increase. The good part, looking at it this week, we're in early May, that we feel that the worst part is already behind us in April. And we see the number of hospitalizations decreasing in Yonkers and the county and the state. We see the number of deaths increasing, in some communities, but in general decreasing, which is good. Which brings us to, what is being corrected different from what we spoke about last week. One area is nursing homes. And we spoke last week about how nursing homes were a problem. We began to see that there was about 5,000 deaths in New York State. And here locally in nursing homes, we realized that there was really a serious problem. Why? Because nursing home patients, in our opinion, were not treated in a proper way. We now know that many of the people that died because of the virus had underlying conditions. They had diabetes, they had heart disease, high blood pressure. So if you're not taking care of those issues, the body is weak and the immunity is weak, and therefore people are not able to survive the virus. We're also realizing that there wasn't adequate testing in nursing homes. So during this past week, the governor and the state demanded that nursing homes must make sure that all their employees are tested at least twice a week. So that at least assures us that the people that are working with this older population, this population that is really many of our loved ones, that for the last 2.5 months, we were forbidden, many families were forbidden from seeing their loved ones in nursing homes. We understood the fears of COVID-19 and the virus, but then to find out there was a high number that were dying and losing their lives, and it was a tragedy. So one major improvement since last week has been the whole issue of nursing homes. So it seems like that's going back on track. The other major issue is what's happening in Washington, D.C., what's happening with any potential new stimulus packages. And what I'm hearing and what we're looking at is a situation where a new stimulus package anywhere between $2 to $3 trillion is in the works. And now the debate that I think is going on now is really whether or not a lot of the new funding sources should go to businesses, should go to individuals as continuous stimulus support, whether or not certain percentages of that funding should go directly to states and municipalities and communities, because the biggest issue we have now from the state and even from Yonkers is our budget. We're not collecting adequate taxes. The projections for sales tax that brings in quarterly revenue to the state and the communities is way below where it should be. And we understand why. People are not shopping, people are not buying, the economy is basically nearly at a standstill. So we're at a point where when we started April 1st and voted the state delegation on a budget for New York State, we already had anywhere from $5 to $6 billion shortfall. This is before the pandemic. And now we got a pandemic that brings that number anywhere between, when I look at the data, $10 to $15 billion. We're in the shortfall. So now communities like Yonkers, and we're faced with a potential shortfall that would bring about major layoffs, whether in the school system or on the city end, if we don't get revenue to at least fill the gap. And that revenue, we're hoping, comes from the federal government in this new stimulus package. Money
Now,
that goes
Mr. Nader, before we go too far into that, allow me to ask a question here and there. So, question that I'm receiving from people. Now, in Yonkers, according to the President of the United States, anyone who wants a test can get a test. Does that apply to Yonkers? Anyone in Yonkers, Westchester County, who wants a test, can we get one? Anybody?
Basically, it's easy to say that anybody that wants a test can get a test. But as we spoke last week, and I think it still stands as far as my opinion, I don't believe there's adequate testing going on. I believe that, the state, not only after a lengthy delay, nearly maybe a week to 10 days ago, put a new testing site in Yonkers, but it was very limited. The testing site dealt specifically with one area code in Yonkers, which is an area of need, but there's also a lot of other areas of need. So the focus was on 10701. There was a limit to 25 tests per day, and there was also a need for appointments. And as we spoke last week, it seems like, what's really helping is many private doctors, private practices that are conducting testing and doing not only the regular COVID-19 tests, but the antibodies test. And a lot of individuals are going through those sources. Some are covered by insurance, and honestly, some people have to pay for it, but it shows you the fear and the concern many people have. So although the president would like to believe that testing is readily available, it's not readily available.
No,
I think there's a big push to make more.
Mr. Nader, I don't know if I would agree with you on that. I don't know if that's the president who wants to believe or if the president wants us to believe, okay? Because I know that he knows, as a president of the United States, he knows that not everyone can get a test. So if you give people that you lead false information, what do you expect the reaction would be? And now we hear in reports that 3 children have died of COVID-19 related issues. Now it's affected a whole new generation if this turns out to be true.
Yes, it's serious. I hear from healthcare professionals really a sense of not only urgency, but as you said, a serious concern that, we thought this would impact the weak and the old, but then we realized it was really intergenerational. And now to see that there's the last report, some 100 cases of children, and as you said, 3 have died, young people ranging from an infant to an 8-year-old and so forth. And these are young people that are getting a certain form. They haven't clarified exactly whether it's COVID, but the belief is it is COVID related, and it is symptoms that deal with the respiratory system, where children have trouble breathing and so forth. So now we're telling the public at large to be sensitive if they have children or grandchildren home, to look out for them and to make sure that if they have symptoms, to immediately seek medical attention. Historically, we think a kid has a flu, has a cold, and they'll get by it. But honestly, in these days and times, you want to be more cautious. You want to make sure that we don't take chances, not only with seniors, but also now we're learning with our young ones. And that's one of the problems we have. And that's why when you listen to Dr. Fauci and you have that debate, as we said earlier, going on between, do you bring the economy back to fold? Do you start reopening? The pressures are mounting both ways. And as we said in the last show, many of us in public service, agree that we'd like to see the economy and some ease on restrictions, especially if it's outdoor, if it's, safeguarded, if there's conditions that allow for distancing, that if there's ways to assure us safety and open some regions of the state or some businesses, as now we're looking at, that maybe that's something we should look at, we should explore and move in that direction. Because, from one end, we got to be safe, and from the other end, any continuous delay in closures, has a big negative impact on the economy and our lives and so forth. So I have a concern when you see 45 states across the nation moving ahead pretty fast with reopening, and some of them have not even reached the apex that we in New York and now New Jersey is beginning, and Connecticut is beginning to, flatten their curve. We in New York have gone through that, but then the fear is that, and that's why there's a lot of uncertainty. What happens when the weather gets a little cooler? Do we know whether the antibodies that many people have, how long would that last? We don't know how long that would last. The hope is if I have an antibody that, I'm set, I won't get this flu, I won't get this virus, but we're not sure if it lasts 6 months, does it last a year? Is it something that protects us long term, which is something we hope would do? And what impact would having COVID-19 have on our lungs and our health long term? These are questions that, from the medical community, we're looking at the data, and we're trying to make sure that, whatever safety precautions we take.
Well, Mr. Nader, universities are already canceling the fall session. So it could be very well that schools will also delay the openings in September. We just don't know. And the impact that this is causing to the general population in Yonkers and everywhere, but we are talking about Yonkers because this is based in Yonkers. You are an assemblyman in Yonkers area. So the people of Yonkers are extremely concerned that they have no jobs. Many jobs are not opening back. Those that might open might cut back on personnel. Board of Education has announced a strong possibility of layoffs. First responders the same. So this is going to cause a huge issue. how are the people supposed to pay rent? How are we supposed to pay our utilities? This stimulus check that we got, it's $1,200. How far can that really take you? You know, how can that really help you? You know, if you look at all the issues and problems and impact that this situation is going to bring you. And I think we haven't seen anything yet. There is much more to come, I feel.
Well, there is, and you're right. You know, the concern we have is, and that's why those that are arguing or pushing for reopening, you know, cite exactly what you're talking about, that the longer people stay out of work, the longer businesses are closed, the less likely that many of these businesses would be able to go back to their pre-pandemic status. Many of them, unfortunately, will close, and many of them, if they're able to survive this, may not hire the entire staff that they once had. And so this is why I think it's urgent to get the economy at least on certain cylinders, as they say, not a complete reopening, but as I said earlier, to really look at areas where it's safe to do so. You know, a lot of people would argue, you know, as long as there's construction to be had, why should you stop construction if it's outdoor, especially if all the employers and employees, you know, have safety precautions with masks and gloves and so forth. The other concern is, you know, you spoke about schools and education. You know, it was reported that based on the 22.5 million potential shortfall Yonkers schools has, that there may be 189 layoffs. That includes teachers, CSEA, and administrators. And as you said, we're not even sure if we're able to open schools in September, but this is why I've been urging the governor's people and the state delegation and local representatives to work closely with educators and to really have a plan. And the plan may consist of option A or plan A and plan B and plan C. The plan A should be, you know, by all means, a hope that we can fully reopen schools in September and really get instruction largely in classrooms. Potentially that may be unlikely. So you got to have a plan B that has a combination of classroom instruction where the kids go half their time to classrooms in smaller groups, because we don't have the space, classroom space in Yonkers, for example, to split up every class by 14 kids or 15 kids. So we're stuck where we may have to have, like they do in colleges, a class, you know, team A and a team B that alternates 2 or 3 days a week in classroom and the other 2 or 3 days online. So I see a future where online instruction is not going away. You know, my hope is that we don't restore online fully, because what I hear from teachers, at least half the children really still don't get it, and they're not getting the benefit of online instruction. And they feel that, you know, they're losing out potentially on an entire school year. So we got also, as an educator, I know the value of targeted instruction and making sure you have after school instruction. There's a possibility you may say, you know what, we want the kids permanently this coming school year to make up for the loss of instruction, to have a school day from 8 a.m. to 5 p.m., 5 days a week, or do it 8 a.m. to 5 p.m., as we said, with alternate schedules this way, and making sure, let's not call it after school, but it really is after school and becomes mandatory for every child, and use that additional time to really catch up on any potential losses. Some people will argue and say, well, online is working. Yeah, it works, in my opinion, really well for 25% of students, practically meets the expectation maybe to 50%. And I really feel that the remainder are not technology savvy. They don't have the right technology or the right internet access, or they don't have the proper support at home to really work with the teacher to make sure that the work is being done. So I see a tremendous need now to make sure that through the governor's task force, that he has educators involved with the advisory committee, that he has individuals that can look at the finance, how does that impact transportation, how does that impact busing in the case of Yonkers and so forth, and the cost factors. And a lot of that depends on whether the federal government in this new stimulus package, gives the money directly to cities and the states. This way, a community like Yonkers can at least know moving forward, yes, we can avoid layoffs, we can have stability in our labor force, and we can begin to have 2-3 options on the table planned early on. This is how we will proceed with education in the event the virus is completely gone and we have a vaccine, and that's the biggest hope each and every one of us has. And then the middle ground. The virus is going to be around. Yes, we can control it. Yes, we can be safer, and we can work around it. And the third, which I hope neither one of us would wish for, is that there's such a reoccurrence of this virus that causes us to seriously look at reclosures. And at that point, you're looking at a doomsday economic outlook.
I agree.
But let's hope we do that.
Now, Mr. Nader, I think soon we should be adding another curriculum to the schools, which is online education. Because as you said, many kids are not tech savvy to do this. And we need to train them as a backup. If it's needed, we know exactly what to do. Now, I remember one of the issues here in our school systems was that we had too many kids in each classroom. Now with the social distance, and if we have to open, how are we going to manage? And one of the reasons why we had too many kids in the classroom was because we did not have the space for additional classrooms in our schools. So how, this is like catch-22. We really don't know how to do what to do and how to move forward.
You're so right. That's why, my opinion is, you can't have, one plan of action on the books ready to go. That's why you gotta really have educators, and you gotta have specialists in the field put a number of packages, because a lot of it depends on the circumstances we're dealing with. But we gotta be forefront, we gotta be proactive, and as you said, we got to recognize our circumstances. We're a school district where the average school building is 80 plus years old. And already from this past school year, we were 4,000 to 5,000 kids short as far as space is concerned. That's why we put proposals to get the state to fund us. And as I've been arguing all along, that the state funding process that's based on the wealth of the community shortchanges Yonkers. They give us a lot less money per kid because we're part of just the county. But then you look at the number of our kids that are economically disadvantaged on free and reduced lunch. It's a high number. It's nearly 80%. So I say, where's the correlation between, the status, financial status of our children we serve and the status or the wealth of Westchester County? There's no correlation there. And that also applies to the amount of funds they give us to rebuild schools and expand our schools so that we can have more capacity. In September, as we said, with distancing, it's impossible to go back because we have no other space. So to put kids back, 28 and 30 kids in a classroom, you can't have distancing with that. So if you do classroom instruction, and you need some sense of distancing, you can't have more than, in my opinion, 15 kids a class to potentially try to keep the kids distance from each other. You don't have the space to do that unless, as we said earlier, you have the kids coming half day to classroom in smaller groups, and the other half is doing online instruction, and then they reverse, alternate days or whatever the case may be. that's the only way, and that's the plan that a lot of educators are looking at. They're looking at expanding not only the training and knowledge for students and parents, but in my opinion, many teachers are not experts with technology, and many are learning the process. Maybe this is a good initiative, a reason for every teacher in colleges and universities that are educating teachers to prepare them better for greater utilization of online learning. I think in the past it was supplemental, it's good to have. Now I think it should be mandatory,
Now
where
it's a must.
anyone, it's a must. Anybody going through educational training, certification, administrators, for example, it must be mandatory and a must that they may have strong technology background and training, online education. A lot of people rightfully are arguing the old days of kids carrying textbooks and books. We may not need that in the future. Maybe we should, put instruction online and allow children really in the school system stop wasting paper and stop this whole concept. Everything has to be textbooks and the cost of textbooks and workbooks. I know each year you have to, if a kid makes, uses or makes some marks in the book or it gets outdated, you throw them away. So the cost factor of buying textbooks, but putting the information online and allowing children to really at an early stage to start maximizing their technology skills really becomes more cost effective. I think there's more access to knowledge through the use of the internet. But again, you got to make sure that the technology is made available. Many students don't have that available. You got to make sure to some extent parents are given and taught best skills that whether through PTA or the school districts, they should have an ongoing process of training for adults, for parents, whether through adult education. We have a large English language population. We've been advocating adult education when people were saying cut that funding. And we kept arguing over the years, how can you cut the funding if the majority of our children speak another language at home? Don't we want our parents to also become aware of the educational process to improve the homeschool collaboration and cooperation? So I think we all see the need for technology, online learning, but we got a way to go. So this is an
Well,
area that we got to work on heavily.
well, Mr. Nader, this is all the time we have. I think we are now reinventing the education system. We are reinventing the way we must educate our children. This pandemic has taught us many things that need to be changed and adapt to the new way. So thank you very much. I will see you next Wednesday at the same time. We have a date.
We have a date. We're ready to go, and hopefully we'll get more progress and more good news this coming week. That's our hope. And thank you for continuously expanding the information.
Thank you,
Always
sir.
a pleasure.
Until next week.
Thank you.